Good afternoon, families. Thank you very much for joining us for our Parent University session today. My name is Kyron Harvell. I am the director of the STAR grant for the Lane School District. STAR stands for School Transformation Accelerates Results. We're very fortunate this evening to have Dr. Andrea Calabrese and her team from Child and Family Charities. They will talk with you about the service supports that they are providing to the Lansing area. So I will turn it over to Dr. Calabrese and I will make you the host in case you would like to show us anything.
Okay. Thank you. So hello, and I'm here to talk about Child and Family Charities. So we are a family service organization in Lansing. We've been in Lansing for over 100 years, and we have many programs that we're able to provide the community, families, children, and adults. And we wanted to share some of what we're doing for individuals who may be interested in seeking out some services. So some of my team members are going to be joining. Oh, here's one now. So let me introduce Kathy Kelly. So Kathy Kelly is our director of our Family Growth Center. And since the pandemic, they've been doing some very amazing and interesting and very creative services for families in the Lansing community. So Family Growth Center is located on Cedar and Mount Hope, but unfortunately their doors are closed, but they still are providing lots of services to families. So Kathy, do you want to talk a little bit about what Family Growth Center is doing currently and how they could support and assist any parents that are needing services that have children that attend Lansing school districts?
Okay. Hi there. I don't know why it says Andrea on my little screen, but I'm Kathy. And at Family Growth Center, we're providing lunches on Thursdays for our presently enrolled families, but we're also giving them resources of what other meals are available in the community through the Lansing School District, through the YMCA. Also at the Family Growth Center, there's a local food bank. So I'm there assisting folks if they are in need of Medicaid services and outreach. We also run a small food bank. So if anybody calls in need of food, we can put things together for them, as well as pretty much the hot call right now is diapers. Diapers seems to be a great need right now, or giving parents resources where they can find things. Mm-hmm. That's what we're doing currently.
So what are some of the requests that you are receiving from parents that you can help with as far as connecting them to resources?
Right now, 211 has been a great assistance through the United Way, helping parents there, helping them with food, delivering it to them so they don't have to come out. A lot of them, if they have children, they have transportation issues or childcare issues. Any services, we had a grandparent who's watching or taking care of her, I think 4 grandchildren, and at the beginning of the pandemic, she had no laptop, no means of even putting on videos for the young children. So we're able to get her a small DVD player and found some used DVDs to entertain the young ones, you know, an hour or so a day just to give her some respite. But anything that parent needs, we'll try to connect them in the community to whatever we can find. But diapers, food, fresh fruit is a big thing. We also have the Food Navigators program at the local Southside Market on Thursdays. So we have access to fresh fruit and vegetables, which a lot of times the food bank does not have. So.
Now, when it comes to serving families, Kathy and her team are very well versed in early childhood development. So they provide activities for parents who have small children at home. They also are a huge help in parenting, any type of parenting help or questions. So I do want to highlight that aspect, Kathy has taught child development classes at Lansing Community College. She helps some of our young moms
Yeah,
with a lot of.
Yeah, parents will come in and let's say, okay, my child's doing this. We had a 2-year-old that was licking everything in sight. So, we give grandma in that situation some instances of, what to do when that happens. Potty training right now is being very successful because a lot of parents are home. So they're able to take care of that. And just having the kids choose activities that keep them involved for the parents. We give them child development information through mailings. We send out mailings each week, and we gear them toward, for parents that have infants and toddlers, those activities as well as information is geared for that age group, as well as our preschool ages. And we usually take care of children up to age 6. By then they're in the Lansing School District. And so we can make referrals prior to that. We also work in connection with Great Start and Early On as well. So we can give parents those resources as well. We have a lot of parents that are going to be starting with Head Start, but they decided to do remote learning this year. So parents are looking for that, just somebody to talk to, so they can call. My phone number is out there. I just give my cell because it's a lot easier rather than calling the center. So they can call my cell and I can call them back when it's convenient for them. But we do a lot of outreach.
Okay. So what I'm thinking, Kyron, is I can be the clearinghouse because we have so many different programs, and I think it's going to be too difficult for parents to figure out where to call to get what they need. So I can assist in that. So
Sounds good.
you can give my email and I'll give you my work number and extension as well. So I can help.
Sounds great.
Because otherwise they're going to be bombarded with all these different numbers and people, and they may be like, I'm just trying to find strengthening families. That's how I can navigate them to that.
That'll be great.
So, did you have more, Kathy?
I was just going to say, and if that list gets long, you can always send them my way as well.
Yes, Kathy can help me too. She's been in the community a long time, so she can definitely help. So other programs that we have at Child and Family Charities. So I oversee our behavioral health program. So within our behavioral health, we have a clinic that is located on 5 Oaks Drive. We're right off of Jolly and Dunkel, and we are we're behind the McDonald's. I would say McDonald's and Burger King, but Burger King is not there anymore. So our clinic is open Monday through Friday, and Monday through Thursday it opens at 8:30, closes at 7. And Friday we're open 8:30 to noon. So we also provide teletherapy, and teletherapy doesn't mean only video. We do telephonic as well. So we will do therapy over the phone. We do video therapy, or we will do face-to-face therapy. We provide mental health and substance use disorder therapy in our clinic. We have several therapists who have specializations, and we do have therapists who work with children as young as 3 and as young as 5. We do individual therapy, family therapy, couples. So it's a wide variety. I can say that the younger the child, the therapy that's going to be most effective is face-to-face. So we could discuss if that is a need. And again, I can navigate you through the process if you're seeking any type of, wellness support. And we're definitely here for that. We know there's a big need. So and we want to make sure that we help whoever needs the help. So that is our behavioral health clinic. And I had asked our juvenile justice director to join us, but I'm just going to give an overview. He has some amazing new programs that are very exciting. In fact, we have a therapist as well that could be very helpful to families and to, she particularly works with teens, 14 to 17 years old. So that's her specialty, and she does some prevention work and some emotional wellness work with teens and their guardians and their parents. So that is one of our newest programs. It's our Youth Success Program, that's what we're calling it. And we have also our Strengthening Families program is through our JJ division as well. And this is a 11-week family work, like group work. So it's all virtual. The staff were trained virtually. It's an hour-and-a-half commitment a week. And it's with the parents and youth 7 to 17 years old. So we work as an entire unit. We work with the family communication, support, any type of difficulties, any of that. It's a great program. It's a nice curriculum. There are incentives. We want to reward our families who are committed. So we do have a wonderful gift card at the very end, and meals. We will provide meals. We will send meals to you. And Jennifer joined us. I was just finishing up juvenile justice, so if Sydney joins us, he can add his flair. But Jennifer Mcmahon is our division director of our Gateway Youth Services. So some of the parents may be very familiar with, there you are, very familiar with Gateway because they've been in the community for 70 years, 75. Boy, you're muted. Am I muted?
Since 1970.
Okay, that's a long time. So Jennifer has been with the Gateway for several years, and she has an amazing team. And I will let her speak about the different services and the connection that you've had with Lansing School District for many years as well.
Okay, we are the Gateway Division of Child and Family Charities. So our population of focus is runaway and homeless youth. We work with youth between the ages of 12 and up to 24 now. So, and we provide a variety of programs and services kind of along a continuum, starting with our prevention programming. And we really want to emphasize and market our prevention programming because our prevention is really targeted towards the minor youth, the 12 to 17-year-olds that are struggling with family conflict for a variety of reasons. Family conflict occurs for all kinds of reasons, whether it's a blended family, a family who's going through a divorce or a separation, a family who might be struggling with financial stressors, a family who's struggling with either substance use or mental health that's causing like some additional strain on family relationships. So anything that could lead to potential premature family separation, whether it's the youth kind of starting to separate from the family, staying away from the family longer and longer periods of time, the family getting frustrated and asking the youth to leave because the conflict is just so high that it just puts a lot of extra stress on the entire household. So we have therapists and case managers who can do family counseling and case management services. And we do that wherever it's most convenient for the family. So if going to the family home is the best place to do that, we will go to the family home. If coming into the agency is more comfortable, we can do that, or we can find a neutral place out in the community. But our goal is to just work with families to identify the root causes of family conflict and then put together a plan to address those, whether that's greater connection to community resources, whether it's family counseling, or just kind of taking the opportunity to digest things as a household, and figure out some new strategies to improve communication, to get the family, engaged in family activities and rebuild relationships. So our goal with our prevention services is really to try to keep families intact for as long as possible, especially with regards to those minor youth. We also have an emergency shelter, and they can, youth can access that emergency shelter. So if they had a family conflict and they ran away from home, for example, and they just don't know where to go, we can provide up to 21 days of shelter. And our goal there would be, one, to keep the youth safe and off the street and sheltered, but two, to, again, get back in there and identify what are the root causes of family conflict and what can we do to put that youth back in their home if that's the safest place for them to be. So we work with the families and the youth to talk about what led up to the youth being separated from the family and how can we reunify that. And sometimes it's a conflict that just erupts. Either the youth runs away, the family kicks the youth out for a period of time. We make sure that the youth isn't on the street, because we know that youth that are on the street within the first 24 to 48 hours, they're at most at risk for being picked up by human traffickers. So we want to keep them off the streets. And then again, we want to just find the safest housing options available for them. And if going back home isn't the best option, then we work with the families to just try to talk about what are the other best solutions, whether it's extended family, friendship networks, or residential programs. So we also have a transitional living program for older youth. So let's say that family reunification is not possible. We've looked at that option. We've worked with the family. Maybe it's a situation where domestic violence is just happened a couple of times, and going back home is just not the safest place for that young person to be. And it could be that the young person is the aggressor. So we look at other options. Our transitional living program is for older adolescents between the ages of 16 and 21, and they can stay in our shelter for up to 18 months. And during that 18 months, we kind of digest again what are the issues that led to homelessness, and what can we do to work with that youth to create a plan to move towards independence and self-sufficiency. So with that, our therapists are working with the youth to help them heal and recover from trauma, because being homeless at such a young age is traumatic in and of itself. But typically 100% of the youth that we see have experienced some sort of childhood trauma well before that. And that often contributes to some of the family conflict that we see. We also have case managers that are talking about how to move towards self-sufficiency. So we're talking about, where are they at education-wise? Are they still going to school? How do we keep them in school? If they're not going to school, how do we return them to school? How do we help support them and make sure that they have the resources and the connections and the support that they need to finish school towards graduation, and then looking at post-secondary schooling options? What career goals do they have for themselves? And how do we start them on a path toward that? Helping them to obtain employment, helping them to learn budgeting skills, and helping them to also understand how to access affordable housing, and what resources in our community do we connect them to help them do that. So the goal with our transitional living program is to actually move them towards independent and self-sufficient, affordable, sustainable housing. We also have scattered site apartments, which is kind of like a next step for some of our older youth, our 18 to 24-year-olds. So, I just don't know what 18 or 19-year-old is ready to be completely financially self-sufficient and independent and on their own. So, knowing that we work with those youth and where they're at, we do a lot of assessments. And again, we put them in scattered site apartments. So maybe shelter living isn't the best option for them, because our shelter, we house up to 14 youth at once. Sometimes living in a congregate care setting is just not the best solution for everybody. Somebody who is struggling with significant anxiety or depression, or has difficulty, living with others and on a revolving door basis, the shelter might not be the best option. So we would work with our landlord partners in the community, place them in an apartment. We co-sign leases for them, and we make sure that their rent gets paid every month. And then they work with us to create a budget, and then they pay us like 30% of their adjusted monthly income towards their rent and utility expenses. And again, the goal is to kind of help them understand what they need in terms of income to move towards affordable housing, how to help them increase that income, what are some options in terms of, you know, continuing with schooling, looking at ways to learn like some really great soft skills for employment, to have options for promotions or getting additional hours or increasing their wages. So just kind of helping them cover that. And then really we cover every element of their lives, from, you know, making sure they have access to healthcare and medical insurance and are able to take care of that, so healthcare doesn't become a barrier for them to becoming self-sufficient and independent. We look at mental health, we look at substance use, we connect them to community resources, and we work a lot with a lot of young families. We found that there's just a lot of families with a youth head of household, so a young person between the ages of 18 to 24 who's got dependents, and connecting them with those resources too. And a lot of them are through the school system, through the ISD, through you know, early on and Head Start programming, just to make sure that they get connected to resources so their children are measured, and making sure that they're hitting their appropriate milestones, and that they have access to childcare that is safe and affordable. And we help them apply for all of the mainstream benefits that they would be eligible for to help them get on their feet. So that's kind of Gateway Division in a nutshell.
Thanks, Jennifer. Sophia is here too. And Sophia also works for Gateway and is in the community a lot, and is a Lansing native, and knows Lansing School District well. Is there, do you want to talk about SOP and TRUE and
Open Table?
Open Table? Yes.
Yeah, I'm so sorry. I don't know what was happening when I logged in from my phone, and then now we're all logged in under Andrea, so I do apologize.
It's because I sent you all my link. That's why you're all named me.
I was on, but I'm like, I don't see my picture. I don't see anything. I'm like, okay, so I'm going to try to switch to something different. So I'm sorry. Yes, Jennifer said it eloquently, but I can talk a little bit more about our Street Outreach program and how that intertwines, and how it would be amazing with the collaboration, how we can work together. So our Street Outreach program specifically works with young people from ages 12 to 21. And so that covers middle school, high school, and then to a young adulthood. And so we work with young people that are the most vulnerable. So they're either living on the street or they're couch surfing place to place, and they don't really have somewhere to go. Our Street Outreach team consists of 2 Street Outreach staff and myself, and we have 3 peer navigators at the moment. So we're quite small, and we cover the Tri-County area, so Ingham, Meaton, and Clinton County. And our street team goes out just to kind of educate young people if they are experiencing homelessness, because as you know, Kyron, we all have different definitions of homelessness, right? We have the school definition, but we also have HUD's definition. And so young people kind of don't understand, well, hey, I have somewhere to go, but it's not my place to go. I'm sleeping on someone's couch, I'm sleeping over here, or one night I'm at my aunt's, another night's at my grandma's. They have somewhere to go, but it's not a consistent place to go. So we do educate young people about what homelessness means to us, because we use the school definition of homelessness and serving practices. So we do that, and then we also engage with young people that are living out on the street and helping them get off the street. So we provide them with basic needs, and a lot of the times that's their first interaction with our services is the SOP team. And so we provide them with basic needs like food, clothing, hygiene, as our way to gain rapport for these young people that are out on the street, because at that time they don't have anybody and all of their systems of support have been broken. And so that's our way of getting in with them and helping them get off the street. How that intertwines with school is oftentimes we're in the school, we have lunch tables, we talk with teachers, we have an amazing relationship with Rose Tap House, which I'm sure you're aware of. And so this year was supposed to be the year. This year we're supposed to be in the schools with Rose, have this thing going on, and then COVID happened. And so a lot of our referrals come from the school system, from teachers counselors, therapists. And so we're kind of missing that component and how we can intertwine. Now we've had partners that have said, hey, you know, we'll be happy to advertise for you guys, but that's not the same of hearing it from the teachers, hearing it from the staff that are engaging with them, maybe virtually or in person, but that's kind of where we're at. Now, within SOP, we also have 2 other programs. We have our TRUE, which is our LGBT support group, and it's peer-led for youth ages 14 to 18, school-aged. And so it's a support group for young people where it's peer-to-peer, and they are able to express however they want to identify. And that's led by 1 staff member and 1 volunteer. And they operate that every Tuesday from 4 to 5:30. And so we'd like
one
to
second, Sophia. Kyron, does LSD have a gay straight alliance?
I think they have a couple.
We have it at a few schools. I know Eastern has one and a few other schools, but there's no like district-wide program for that. But a few high schools have it, correct.
So this is a nice supplement to a GSA.
Definitely.
Which is also in the community. And we were, when Salis Center was open, which is, I consider Lansing's Pride Center. They were hosting us there, which is a great location, very central location, easy for youth to get to, I think. But sorry to interrupt you.
No, you're totally fine. It's totally true. Like we are still meeting just virtually. We do have a couple of outings that we try to do outside. We're very safe. We wear masks, and Mercury, our facilitator, is very key on keeping social distance, and so we're very safe in that. But yeah, we can definitely, like we've reached out to the GSAs that exist. We have our volunteer facilitator is actually connected with Holt schools, I believe, but they have relationships with other school GSAs. So we've kind of tried to do that to have them at least have some type of support on this platform that's virtual. And then we have another program we just started called Open Table, which is amazing. It is a mentoring program where there's not just a single mentor, it's up to 6 to 8 per young person. And we're providing them a support system to allow this young person to feel and get their needs met once they leave our programming. And so right now, we're on the infancy of this program. We have started One Table, which we're really excited about. And it's very, very new. I think there's only one other program in the state that does it. I could be wrong, Jennifer. Correct me if I'm wrong. We're very, very new to this. And so we're if you know anybody that wants to be on a table to try to help these young people, because once they leave the schools, once they leave, we don't really know what happens to them. And so Open Table, being a mentor on Open Table, would allow you to kind of get that experience, like, okay, I can be part of this journey longer than they're with me during the school day, longer than they're with me during the school time. You can be with them for the rest of their lives. That's how the platform is. So we have one coordinator for that, Markela, who is currently on maternity leave. And so I'm the coordinator for that for right now, at least for 6 to 8 weeks. So that's where we're at. But if we do have a flyer for that, so if you're okay with Andrea sending that out, and maybe you can send out to your staff and the teachers, and really, I know a lot of teachers that really want to do something, like they're like, I don't know if I have time. Right now we're doing it virtually, so it's possible just to pop it in from your own home.
Thanks, Sophia. And parents who are on the call tonight, if you would like to mentor a youth, it's not, it's open to the community, whoever wants to sit around the table to help mentor youth, because we know one positive long-term connection, the success rates go up higher for youth being connected into the community. And that's what we're really trying to do, is to really wrap around our young people to keep them, connected and stable and, doing well. So Sydney, thank you for joining us. But one second, Kyron, do I have the ability to share my screen?
I believe you do, but I'll share it with them. I'll go ahead and take care of it.
Okay.
Let's see. So he is now the co-host. He can share whatever you'd like to share.
Oh, okay. I wanted to share our.
Oh, I'm sorry. You want to share? Okay.
Yeah, I think I'm able to.
Yeah, you're still able to as well. So both
Okay.
of you are co-hosts. Both of you can share. Mhm.
Oh, okay. I just want to make sure I gotta move my.
Is that you? Because there's 6 of you on right now, so that's you, right?
I don't know if you guys can see it though.
Yeah, we see it.
You see our website?
Yep.
Okay. So that's what I wanted to share, because this is so much information coming at everybody, and it really kind of puts the depth of our services out there. When you go to our website, everything is, we've talked about.
Dr. Breeze, I'm sorry. We're on ZipRecruiter now. Do you want to show ZipRecruiter or the website?
Oh my gosh, I'm so sorry.
No problem. There you go.
There's a website.
All right.
Oh my gosh. So our website shows all of the programs that we have discussed. Sorry, I have a double screen, so I'm not sure where do I put my website. We have child welfare services, but for tonight we're talking about the Family Growth Center. We've talked about behavioral health. Sydney's gonna give more in-depth information about juvenile justice. Jennifer and Sophia have talked about the Gateway Youth Services. And we do a lot of work with trauma and trauma education in the Tri-County area as well. So if individuals are interested in that, we can also talk about that as well. And I know, Kyron, you're very interested in getting some support and training in that area for Lansing School District. So Sydney, if you want to talk about your programs.
Hello, good evening, everybody.
Good evening.
First off, I wanted to talk about our I consider the flagship program of juvenile justice, and that would be teen court, the diversion program. Our teen court, some people may know it as Ingham Teen Court. If you're familiar with the program, it's been in existence over 20 years. And so we accept referrals from Ingham County Prosecutor's Office, Holt High School, Lansing School District, Office of School Culture, as well as 30 Circuit Court Family Division, and on occasion some parent referrals, but those are kind of extenuating circumstances. And so that's our first program, our Teen Court Diversion Program. We work with kids 7 to 17. It's right now it's 100% held virtually. When things were normal, and we were moving around in the world in person, and face-to-face contacts are all going on. We operate twice a month and conduct accountability hearings, mock hearings, where we are in partnership with 7 schools within Ingham County, as well as Cooley Law School professors and assistant dean. They serve as volunteer judges for our accountability hearings. And during those accountability hearings, the kid is already accepted, or the youth or the respondent, we refer to as the respondent, they already accept responsibility for their delinquent behavior and their offense. And so during that process, they are asked questions by the peer jurors. The peer jurors, like I said, when we're functioning in a face-to-face world, the peer jurors were Ingham County High School students that were in like civics class, government class, U.S. history, and they served as peer jury members, and they asked tough questions, to these parents, to the kids, and basically to uplift them. And basically at the end of the proceeding, they give a disposition, and they give them, some hard line like tasks to complete, but they also give them some words of encouragement. And this comes directly from peers that are their age. And so it's definitely, we're missing that component from doing it virtually, but We're still, as of May 1st, we're still conducting hearings. I think we're up to, 9 virtual hearings so far since May. And so we do it twice a month. And again, it's all ran by volunteers. And so that's teen court. And then our second program I want to discuss is our Strengthening Families program, which Andrea mentioned earlier. And basically, Strengthening Families is a model, best practice model that's been around for probably about 10, 15 years. And in the old curriculum that we were utilizing when we were doing it face-to-face was a little different than how it's rolled out now in the virtual format. The old format, the parent and the child were separated in different work groups, and then they came back together and did a family session to practice those skills that they learned in their previous groups. Well, this new curriculum is kind of everybody's all together, the family as a unit. So they tailored the lessons to the family as a whole. And so they have tasks they have to complete on a weekly basis, or say homework. And so they work on effective communication, setting boundaries and setting limits, establishing limits or reestablishing boundaries and setting limits. Also, just as a caveat, Eaton County courts and family courts have been utilizing our Strengthening Families program in lieu of parenting classes requirement for some of their clients. And so basically, Strengthening Families, we work, how we set it up with the families is that we have 2 facilitators assigned to 2 families. So they're always with those, with that same group, and they meet weekly for 90 minutes. And each family is allotted a stipend of every week for food, and just because they're taking time out to meet with us for 90 minutes. And so we wanted to kind of duplicate that effect as if we were in person, because if they were in person, we definitely would feed them and provide them dinner. And so that was just one less thing that we thought we could provide the family, so they wouldn't have to worry about it when it came time to meet with us. And so Strengthening Families, again, is 11 weeks. Anybody who resides in Eaton or Ingham County that has children 7 to 17 years old qualifies. And so, like I said, it's 100% virtual right now. And I think that worked out for quite a few families, because sometimes, if you're not familiar, sometimes, families have transportation barriers. And even though in the face-to-face meetings, we still will provide, Uber or transportation assistance. So we try as much as possible to overcome any barrier that you may face. So that's our Strengthening Families. And so one of I call the dual county programs, the second one, Strengthening Families, the first, in terms of us accepting referrals from Eaton County residents or Ingham County residents, is our new positive pathways for youth programs. And this is a prevention therapy service that does not require insurance. It's totally free, based on risk factors. One of the things that we are trying to eliminate is decreasing the number of youth going into the juvenile justice system. And also, in this process, we provide the child with assessments that identify trauma-related risk factors. And our prevention therapist addresses those in individualized sessions. And so this program, again, who's eligible, anybody any youth that resides in Eaton and Ingham County. That simple. So pretty cut and dry. And so those are the 2 what I call dual county programs. Our other program is our Prime for Life program, and it's a best practice utilized model that basically identify kids who are making high risk choices. And so it addresses prevention/intervention strategies for those kids who may be engaging in high risk behaviors. This past year, we were providing Prime for Life services in Lansing Everett High School, and we did a couple cohorts per semester. And so that, I think that went very well. I also, with Prime for Life, now that we are in a virtual format, we've had some challenges with the developer getting their curriculum fully converted over to a virtual format. And so we're just finally got that, rectified, and we're ready to rock and roll now. So I'm glad that's finally happened. And so our next program brings into our other program, Early Intervention Group. And so our Early Intervention Group is strictly a prevention group for kids who may not necessarily meet the threshold to participate in substance abuse treatment. And so during our intake assessments, where our teen court respondents, during that assessment and intake process, they're all drug screened, and depending on the results of the drug screen, we send them out internally to our behavioral health department to have a therapist, substance abuse therapist, provide a substance abuse gain assessment. And also, Lansing School District Office of School Culture and Climate utilizes our behavior clinic just solely for the purposes of doing gain substance abuse assessments for their children, and that's the only service sometimes they request. And so for the kids who don't meet that threshold to participate in therapy, then often the therapist may refer that child back, or recommend that child participate in early intervention group as an alternative to participating in treatment. So that is a pretty intensive. It's a 5-week program. It meets for like 2 hours. We condensed it. It used to be 10 weeks. And so we found that it was challenging to get all our kids that were participating in teen court in and out in a timely manner. And we found that sometimes that was the only thing that was left on their list of requirements in order to successfully complete the program. So we condensed it and made it a little bit shorter. So that's our early intervention group. And then our ICM, intensive case management, this is more of a deep dive into the family dynamics of our teen court respondents' families. And here, it's a little bit different approach from a case manager. They basically go in detail in terms of the family dynamics of what's going on in that family, in that household, and they figure out strategies and supports and resources to align them, with, so that they can be sustainable when they leave. And so our case manager, Crystal George, she's pretty hands-on with these families. And when I say hands-on, she's like, for example, we had a young person whose parent was hearing impaired, and she had very little supports. And so she wanted to experiment with participating in a research treatment, experimental treatment. And so, make a long story short, our case manager, Crystal, accompanied her to her procedure. And needless to say, she gained some of her hearing back. But not more importantly than that, the young man who was in our program, he was feeling overwhelmed because he was kind of like dividing his time as a caregiver, a son, and starting a new job and trying to establish his independence. And so Crystal was able to kind of navigate, create a another alternative support system for mom, and and just overall support that family and give them resources that were sustainable, so that when she pulled back, which it was hard for her to do, we just kind of had this discussion today. That's why I'm bringing the story up about, she was having difficulty with the separation from that family, because she did so much work with them and got them on her, got them where they needed to be. So that's a little bit more, like I say, it's intensive. It's a little bit more hands-on with all family members in the household. So that's our ICM program. And I want to say that's it. Pathways in our JJ pilot program is also referred to as our positive pathways for youth program. And so basically, you know, that program again is designed to service residents in both Eaton and Ingham. And so right now we're working closely with DHHS to try to remove children from entering into the juvenile justice system formally. And so that's where our programs, you know, that's a little bit about our programs. They're all prevention based. But I also feel that our programs necessarily, you know, I think that we're open to the community participating. I don't want to just, you know, say that we accept referrals from municipalities. We don't have to necessarily do that. We can take them from, you know, from families. And like I said, even with our teen court, we've had a family refer one of their their son to our program because they caught him stealing from them, and it wasn't a little bit of money. It was like thousands of dollars, and so they didn't want to per se formally charge him, but they wanted to kind of like use that as leverage in order for them to, you know, get some type of intervention. And so that was kind of new for me because we wasn't used to getting those community referrals, but it ended up working out fine and getting that person the supports that they needed. And that's it for me, I guess.
Sydney, did you talk about team attendance?
Oh, duh. All right, so team attendance basically is an intervention program to be utilized by school personnel. And basically what we would like to do is kind of just identify the barriers that are leading to children being disciplined frequently, or more importantly, chronic absenteeism. And so what we like to do is basically meet with the family, discuss what are the behaviors, create a success plan that kind of like formally like creates a plan A, plan B, and a plan C on how they're going to get their child to school no matter what the circumstance is. And so the goal is to obviously reduce the number of unexcused absences, but also at the same time during that process, it's revealed during the intake that other needs may be there in terms of treatment needs. We have the capacity to, you know, provide them assessments, trauma assessments, or gain assessments, just to give them all the supports they need based on their treatment needs. So it's not uncommon that a child may come or be referred to us by a school for attendance issues specifically, but through the intake process, we find out there's some unresolved trauma, there's some anger management issues, there may be some substance abuse issues, and so we're more than qualified to provide that family with supports and options. And so one thing that I wanted to get away from, because in the past I think team attendance was thought of as a supplement to teen court, and something in regards of tied to truancy court. I'm here to tell you that we support and we will advocate for children, for families who may find themselves in truancy court, but that is not our role, our primary role. Our primary role is to identify the barriers that are contributing to chronic absenteeism or chronic behavior problems in the school. That's our primary focus. Now, if we find that, and it's revealed that the child has been referred or petition to truancy court, then we would definitely be there to support them and advocate for them as well. So this is a service that I would like to see implemented as a tier 2 or tier 3 intervention with our schools. I understand that at tier 1, that would leave that up to you guys, but just as a supplemental support and intervention strategy, team attendance will be the place for that. That would definitely be the place to get that extra intervention needed if you're trying to prevent that child from, being referred to the court. And that's it.
Right. Since I'm on the website, let's see here. I wanted to be able to show you because Jennifer and Sophia talked a lot about different programs. So I just wanted to highlight, here's our Open Table program. And there is a little video that explains what it is to be part of Open Table, correct, Sophia? If anyone was curious about what exactly it is, it's an amazing model. And I can't say, and I'm sure Kyron can't say enough about the importance of mentoring, and that's really what it is. It's a really hands-on mentoring model that's a commitment for someone who wants to help a young person become connected to the community and independent and successful. And I know a lot of Jennifer's programs were on here too. Let's see here. She talked about she talked about the shelter, which is the higher ground is the emergency bed. And then our Crossroad program is the transitional living that she spoke about. I just wanted to go over, there's so much on the website. So every service that we spoke about tonight is here in one place. And I will make sure that Kyron has all the information for you because it's so much, it's hard to remember all of it. Kathy's information is on here, her Family Growth Center. What they do. She talked about her Medicaid Outreach. That specific service is on here as well, the Medicaid Outreach. Connecting families who need health insurance, making sure that they have coverage for themselves and their children. We're big supporters and advocates for making sure that everyone has the care that they need. So there's new services every day. We keep growing. Our behavioral health is on here as well. If you're curious about the therapists that provide the different services, you can read about our therapists who are available and what their specialties are. We do provide a lot of services to Lansing School District directly. We're sad that the schools are closed because we did have a lot of plans to be more present in the schools. I do have a contract therapist in 2 of the elementary schools, so that's been very helpful. But I mean, everything's virtual, so we're all anxious. I'm sure we're all anxious to get back to the way things were. But that's us in a nutshell, Kyron.
Thank you very much for this wonderful presentation. I must admit, you guys must have the most comprehensive program in the state of Michigan. I mean, this is amazing, all of the services and supports you guys provide for families. So kudos to you. I have a question. I used to work for Gateway Community Services in the Higher Ground and Crossroads program. So I was glad to see that pop up. I didn't realize Gateway was under you guys. I worked there like maybe 98 to 03. Is Lily still there? Lily Arnold, he's still there? He's not there anymore. Okay. Well, I worked there back with Mary Scott and Sue Wondolowski like a long time ago. So glad to hear that. For the strength for the first program that was talked about, are there any financial requirements for families or how does that work?
The Strengthening Families program?
Yeah.
No, it is completely free.
Okay. So sign up and they'll be notified within a certain time frame if they.
Yeah. Sydney, do you want to talk about how families get connected and how you have rolling admission?
Yeah. So we have the electronic flyer / referral form is a fillable form.
Yeah, I think I had it up when we signed it.
And so basically, or sometimes I don't even have that. Sometimes I just get a call and I get basic demographic information. I try to get, I vet pretty much all the referrals. I'm the point person for all the referrals. So what I do is just kind of get like a surface demographic information about the family, contact information, number of kids, ages, and so forth, and then get a tentative schedule of when they're available. And then based on that, I give the information to the facilitators, and then the facilitators go into depth about the schedule, how to schedule, the schedule weekly and the standing appointments. And then they coordinate, everything from there in terms of facilitating the sessions and everything. And so what I do with the referral sources is that on a monthly basis, I report out to them, their participation. They attended they attended 4 sessions this month. And so that's how I see it rolling out. This has basically been going on, we just started our first, August? I want to say August, like August sometime. So definitely, I just got a referral today, a new referral contact information from the courts, but it's not, and this is what's kind of weird about, I didn't anticipate these referrals coming from the courts and the family court, but I see the need for it. I definitely do. But I like the idea that, these families get the chance to gain some skills and we learn from them as well, but we also, provide them a dinner while they're going through this. And so we try to take as many distractions as possible, and I remember a parent even saying how appreciative they were, just the fact that they didn't have to worry about dinner on Tuesday nights because they know that, now they got us covered, and so we try to accommodate, as much as possible, dietary needs and so forth. So I definitely see the value in it. I like the fact that it's not, it's basic. The basic requirements are just having children 7 to 17 years old. That's really the basic requirement. So, but that was a challenge because we had the old model 10 to 14. And so that was a little bit of a challenge with the old curriculum. And so I'm glad we're moving forward. And so definitely, I'll be the point person. I'm the point person on the referral form, but definitely I'll be the one contacting the families and gathering the information.
So basically, Kyron, it can come through me or Kathy, and we can get it to where it needs to go.
Okay.
Obviously, it's within Sydney's program, so he would be the one coordinating it. But I mean, it's really, in fact, there's one going on 2 doors down from me right now. There's Strengthening Families going on. I can hear the group leader talking.
Okay, sounds good. One last question. You guys provided an excellent overview, so I don't really have a lot of questions, and I don't see any from our participants. I have one last question. The program regarding the fresh fruit. How do parents get involved with that? I've been really concerned over these last 6 months in terms of nutritional value and opportunities that students have had to obtain healthier food. So how do parents and students get in touch with that program? What are the requirements for that program?
Well, we utilize the fresh fruit, fresh produce, basically more vegetables than fruit from the local farmers market. There's also Greater Lansing Food Bank. We get a certain amount of fruit and vegetables from them as well. So as parents call us, then we're able to divvy out the fruits and vegetables that we do have.
So they could come daily if things are available?
If we have them available, just have them give me a call and we fill the order. Yep.
Because I want to start encouraging parents. We have food sites, of course, in the school district, and we have to encourage them to utilize you guys as well, because some of our families may live close to that area because you guys are right off of Aurelia. So it'd be great. The more community resource, the better. So that'll be good, especially with healthier foods. I think that's great.
Right, yeah. Healthier foods is a big thing right now.
Definitely, definitely.
And I think, Kathy, your food navigators program is Thursdays, right?
Right, Thursday at the Southside Farmers Market.
Which is at St. Pat's, right?
Yeah.
Okay.
Sorry.
Okay. Yeah, so she has a staff, her dogs were barking, so I'll just take over a little bit. So she does have a staff at the farmer's market on Thursdays, and I think is it 4:30 to 7?
It's 3 to 7.
3 to 7.
Yeah,
Okay.
and
So
they usually run out around 5:30.
Okay.
Okay, so 3 to
So
5 to
So
5.
the
there's
earlier the
also
better.
there's also vendors there, Mexican restaurant as well as a Chinese restaurant. So
Okay, so
you
you
get the
get
healthy stuff as well as good food.
Okay, sounds good. As good as good food. Okay, sounds good. Well, guys, I thank you very much. This has been phenomenal. This will be available for Lane School District staff, students, parents, all community stakeholders to view on our school culture website. So thank you guys very much for taking your time for, I'm sure, what has been a very long and busy day. We appreciate the support of the STAR grant of the Lane School District and Penn University. Parents, please join us next week when we will have student support specialist Willetta Ewing and Marsu McAdoo, and the topic will be trauma and resilience. So again, thank you guys very much. I'm Kyron Harvell. Any last words from anyone on the team before we leave for the day?
Thank you all so much for coming to hear us, and we're here in the community ready to serve and support.
All right, thank you guys. Say it again.
Check our Facebook out.
Oh,
All of our updates and website stuff is on our Facebook as well.
There you go, great. Well, thank you guys very much, and everyone have a good evening. Again,
thank you.
Child and Family Services, everyone take care.
Take care, Kyron.
Take care, bye-bye.